1. Synesthesia. 2. Synesthesia is a fascinating neurological condition where the senses become intertwined. For people with synesthesia, stimulating one sense automatically triggers another. For example, someone might see colors when they hear music, or taste words when they read or hear them. This phenomenon is not imagined. It's an involuntary experience where sensory boundaries blur. 1921. There are different types of synesthesia, with some being more common than others. Grapheme color synesthesia is one of the most prevalent, where numbers or letters are perceived as having specific colors. Another type is chromesthesia, where certain sounds evoke vivid colors. These experiences are often consistent throughout a person's life, meaning the number 5 will always appear green to them, or a specific musical chord will always shine blue. Scientists believe synesthesia occurs because of increased connectivity in the brain's sensory areas. While the exact cause isn't fully understood, it's often seen in creative individuals and may be linked to genetics. Many famous artists, musicians, and writers like Vincent van Gogh and Pharrell Williams have reported experiencing synesthesia, suggesting it might enhance creativity. Synesthesia isn't harmful, and many who have it describe it as enriching their lives. However, it also reminds us of the incredible complexity of human perception, offering insights into how unique our brains can be. 2. Hyperthymesia, highly superior autobiographical memory. Hyperthymesia, or highly superior autobiographical memory, is a rare condition where individuals can remember nearly every detail of their lives with astonishing clarity. Unlike normal memory, which fades over time, people with hyperthymesia can vividly recall specific dates, events, and even emotions from years ago, as if they happened yesterday. The Christina Jensen Shell examined people who have frequently said they couldn't remember my face given 2002. This ability isn't the same as photographic memory, which involves retaining visual details after brief exposure. Hyperthymesia is specific to personal experiences and events. For example, someone with this condition might recall what they wore, ate, or talked about on a random day decades ago. Hyperthymesia is believed to result from differences in brain structure, particularly in the amygdala and hippocampus, which are involved in emotion and memory. These areas are thought to be more active or interconnected in individuals with this ability, and, eventually, while hyperthymesia sounds like a superpower, it's not without challenges. Negative memories don't fade, making it harder to move on from painful experiences. This can make emotional resilience more difficult. This condition reminds us of the complexity of memory and how it shapes our identity. While most people forget details to focus on the present, those with hypothymesia live with a vivid, unfiltered connection to their past.
Click subscribe to this channel to get more topics you love.
3. Savant Syndrome. Savant Syndrome is a rare condition where individuals, often with developmental disorders like autism, exhibit extraordinary abilities in specific areas. These abilities can include exceptional memory, advanced mathematical skills, musical genius, or artistic talent. One of the most famous examples is Kim Peek, the inspiration for the movie Rain Man. Peek could recall the content of thousands of books word for word and perform complex calculations instantly, despite having severe learning disabilities. Savant syndrome is believed to occur due to unusual brain development or injury. In some cases, damage to certain brain areas may enhance others, leading to these extraordinary abilities. This phenomenon is sometimes referred to as islands of genius. While Savant syndrome is rare, it challenges traditional views of intelligence and ability. It shows that even when the brain faces challenges, it can develop remarkable strengths. This condition inspires both wonder and respect for the incredible potential of the human mind. 4. Eidetic memory, photographic memory. Eidetic memory, often referred to as photographic memory, is the ability to recall visual information in vivid detail after only brief exposure. For example, someone with eidetic memory might look at a complex image for a few seconds and then describe every detail perfectly. Even days later, eidetic memory is more common in children, though it typically fades with age. True photographic memory in adults is extremely rare, and most claims of it have been debunked. Instead, many individuals with strong visual recall use mnemonic techniques or extensive practice to improve their memory. This condition highlights the incredible diversity of memory abilities. While having an eidetic memory can be advantageous in areas like art or science, it's not a guarantee of success. Memory is just one aspect of intelligence, and other skills like creativity, problem-solving, and emotional intelligence are equally important. Eidetic memory challenges us to appreciate the different ways our minds process and store information. It also underscores the power of training and techniques in enhancing human memory. 5. Congenital insensitivity to pain. Congenital insensitivity to pain is an extremely rare condition where individuals are born unable to feel physical pain. While this might sound like a superpower, it's a double-edged sword. Pain is a critical warning system that alerts us to injury or illness, and without it, people with CIP are at serious risk of harm. For example, a child with CIP might break a bone and continue walking on it, unaware of the damage. Similarly, they might suffer burns or infections without realizing something is wrong. This lack of pain perception requires constant vigilance from caregivers and medical professionals. CIP is caused by genetic mutations that affect how pain signals are transmitted in the nervous system. While individuals with CIP can feel other sensations, such as pressure or temperature, they lack the ability to detect harmful stimuli. This condition highlights the importance of pain as a protective mechanism. It's a reminder that even unpleasant sensations have a vital role in keeping us safe and healthy. 6. Hyperlexia. Hyperlexia is a condition where children develop advanced reading skills at an unusually young age, often before the age of 3. These children can read and decode complex words far beyond their age level, but may struggle with comprehension or social interaction. Hyperlexia is commonly associated with autism spectrum disorder, PAS, though it can also occur independently. Parents of hyperlexic children might notice that their child can read street signs, books, or even medical terms without any formal teaching. However, the child might not fully understand the meaning of what they're reading or struggle with verbal communication. Hyperlexia challenges conventional ideas about learning and intelligence. It highlights how cognitive development can be uneven, with extraordinary abilities in some areas and delays in others. This condition also underscores the importance of tailored education and support to help hyperlexic children thrive. Hyperlexia reminds us that every individual has unique strengths and challenges, encouraging us to approach learning and development with flexibility and understanding. 7. Williams syndrome. Williams syndrome is a rare genetic condition caused by the deletion of certain genes on chromosome 7. People with Williams syndrome are known for their social and outgoing personalities, remarkable verbal skills, and often extraordinary musical abilities. However, the condition is also associated with developmental delays, learning challenges, and medical problems like cardiovascular issues. Children with Williams syndrome tend to show an exceptional ability to connect with others. They are often described as being overly friendly and empathetic, showing little fear of strangers and a genuine interest in people. This intense sociability is paired with strong verbal skills, even in individuals who struggle with other aspects of learning. Another fascinating aspect of Williams syndrome is the frequent presence of musical talent. Many individuals display an exceptional ability to recognize pitch, rhythm, or melody, even without formal training. Music often becomes a central part of their lives, bringing them joy and helping them connect with others. Despite their social strengths, people with Williams syndrome face challenges. Cognitive impairments, such as difficulty with spatial reasoning or math, can make academic or work environments difficult. Additionally, their trust in others can make them vulnerable in social situations. Williams syndrome teaches us about the incredible diversity of human abilities and the importance of focusing on strengths while supporting challenges. It reminds us of the beauty of connection, empathy, and the unique talents that make each person special. 8. Tetrachromacy. Tetrachromacy is a rare condition where individuals, usually women, possess an extra cone cell in their eyes, allowing them to perceive a broader spectrum of colors. While most people have 3 cone types, red, green, blue, tetrachromats have a 4th cone, enabling them to see subtle color differences others cannot. For a tetrachromat, a sunset may display an intricate range of hues that appear as just orange to the average person. Everyday objects like a leaf or a shirt might reveal hidden shades others would never notice. This heightened color perception can feel like a superpower in the visual world. Tetrachromacy occurs because the genes for cone cells are located on the X chromosome. Women with 2 X chromosomes are more likely to develop this trait. However, it can be overwhelming, as the sheer volume of color information complicates decision-making or focus. Tetrachromacy challenges our understanding of perception and reminds us that the way we see the world is not universal. It highlights how biology enhances human experience, making us appreciate the richness of our environment. 9. Mirror-touch synesthesia. Mirror-touch synesthesia is a rare neurological condition where individuals physically feel sensations they observe in others. For example, seeing someone touched on the arm might make them feel the same sensation on their own arm. This condition is linked to heightened activity in the brain's mirror neuron system, involved in empathy and imitation. People with mirror-touch synesthesia experience a deeper connection to others, but often struggle with emotional overwhelm. Watching someone in pain or distress can feel both physically and emotionally exhausting. This heightened empathy can make social interactions intense, but also deeply meaningful. Despite its challenges, mirror touch synesthesia can lead to exceptional levels of compassion. Many individuals with this condition thrive in caregiving or emotional support roles. This condition reminds us of the power of empathy and how deeply interconnected human experiences can be. It highlights the balance between connection and self-care, encouraging us to embrace our shared humanity. 10. Proprioceptive superiority. Proprioceptive superiority refers to an exceptionally heightened sense of body awareness. Proprioception is the ability to sense the position and movement of one's body in space. Individuals with this skill perform extraordinary feats of physical control, such as precise athletic movements or intricate dance routines. Elite athletes, dancers, and martial artists often display enhanced proprioception, enabling them to execute complex actions with grace and efficiency. This heightened sense improves reaction times and reduces the risk of injury by allowing precise adjustments in movement. While proprioceptive superiority is a gift, it often requires years of practice to refine. For example, gymnasts defying gravity or musicians mastering instruments demonstrate its incredible potential. Proprioceptive superiority reminds us of the intricate mind-body connection. It showcases how discipline and awareness can elevate human potential, inspiring others to push their limits. 11. Supertaster. Supertasting is a genetic trait thought to affect about 25% of the population. While it can lead to a refined palate, it may also limit dietary choices as certain foods become nearly inedible. Beyond food, supertasters are often more sensitive to spicy or acidic substances, impacting their overall eating experience. Their heightened sense of taste has made some supertasters valuable in fields like food criticism or flavored development. Supertasters remind us of the diversity in human sensory experiences and how biology shapes our interaction with the world. It emphasizes the importance of respecting individual preferences and the complexity of taste perception. 12. Absolute pitch. Absolute pitch, or perfect pitch, is the rare ability to identify or reproduce musical notes without any reference tone. For example, hearing a car horn and immediately recognizing it as an F sharp is a hallmark of this skill. Most notably, perfect pitch often arises from early musical exposure in childhood and may have a genetic component. It allows individuals to excel in musical fields, as they can effortlessly tune instruments, compose music, or identify notes. Despite its benefits, some individuals with perfect pitch feel overwhelmed in noisy environments, where random pitches clash or struggle with out-of-tune music. Absolute pitch showcases the brain's incredible ability to process sound. It highlights how early learning and natural talent combine to create extraordinary abilities. Some people's brains are creative electrons. 13. Hyperfocus in ADHD or autism. Hyperfocus is a state of intense concentration where an individual becomes completely absorbed in a task, often excluding everything else. It is commonly associated with conditions like attention deficit hyperactivity disorder, ADHD, or autism spectrum disorder, ADS. While ADHD is typically characterized by difficulty maintaining attention, hyperfocus represents the opposite extreme, a profound ability to channel all attention into a specific activity. People experiencing hyperfocus often describe losing track of time and being unaware of their surroundings. This intense concentration can lead to extraordinary productivity or creativity, particularly in areas like problem solving, writing, coding, or art. However, it can also become a challenge when the person struggles to shift their focus to more immediate tasks or responsibilities. The exact cause of hyperfocus is not fully understood, but it may be linked to dopamine regulation in the brain, which affects motivation and reward systems. Tasks that are particularly stimulating or engaging are more likely to trigger hyperfocus. Hyperfocus is both a gift and a challenge. It allows individuals to achieve remarkable things when directed at productive or creative endeavors, but it can lead to missed deadlines or neglected obligations when misaligned with priorities. This phenomenon reminds us of the complexity of attention and how unique brain functioning can create both strengths and challenges. It emphasizes the importance of understanding and managing focus to harness its potential effectively. 14. Acquired Savant Syndrome. Acquired Savant Syndrome is a rare phenomenon where extraordinary abilities emerge after a brain injury or trauma. Unlike congenital Savant Syndrome, where talents are present from birth, acquired Savant Syndrome appears suddenly, often in individuals with no prior interest or skill in the area where their abilities develop. For example, someone might suffer a traumatic brain injury and suddenly develop exceptional mathematical, musical, or artistic skills. In one documented case, a man who sustained a head injury in a bar fight became a mathematical genius, able to calculate complex equations instantly. This is why dimensions, the aspects of a subject that a person can see, are so important in therapy for mental health problems. For example, scientists believe that acquired Savant Syndrome occurs when damage to certain brain areas activates dormant neural pathways. This can lead to extraordinary abilities even as other cognitive functions are impaired. Some researchers suggest these abilities might be present in all humans, but are typically suppressed by other brain functions. Acquired Savant Syndrome is both mysterious and awe-inspiring. It challenges our understanding of the brain's potential and suggests that extraordinary abilities may lie within everyone, waiting to be unlocked. It also highlights the resilience and adaptability of the human mind in the face of injury. 15. Split brain syndrome. It doesn't get any better. Split brain syndrome occurs when the two hemispheres of the brain are surgically separated, typically through a procedure called a corpus callosotomy. This surgery is usually performed to treat severe epilepsy, but it creates unique and often remarkable effects on cognitive and physical functioning. The two hemispheres of the brain are connected by the corpus callosum, a bundle of nerve fibers that facilitates communication between them. When this connection is severed, each hemisphere operates independently. This can result in behaviors where one hand acts against the other, or a person's verbal responses, controlled by the left hemisphere, differ from their actions. I'm going to call this behavior observing your thoughts. People with split brain syndrome can sometimes perform two tasks simultaneously with extraordinary efficiency, as their hemispheres are no longer competing for control. For example, they might draw two different images with both hands at the same time. This condition provides valuable insights into the brain's structure and function. It reveals how specialized each hemisphere is, with the left often focused on language and logic, while the right handles creativity and spatial awareness. Split brain syndrome is a testament to the brain's complexity and adaptability. It reminds us that even when parts of the brain are disconnected, the mind can find extraordinary ways to function and adapt.